Okay, I'd like to introduce myself, Sue Dean. I'm the course coordinator for the Graduate Certificate in Diabetes Education and Management, and we're just welcoming you to the course this evening, or when you tune in it mightn't be this evening, but it's this evening for us. And I'd like to introduce Professor Roger Chen to you all. Roger is an endocrinologist who's Senior Staff Specialist at Concord Hospital and Medical Director at Ryde Hospital Diabetes. He's a Clinical Senior Lecturer in the Faculty of Medicine at University of Sydney, and he's an Adjunct Professor in the Faculty of Nursing, Midwifery and Health at our University of Technology. And Roger has a huge role in the diabetes program and all the short courses that we run in diabetes, and I'd just like to introduce Roger to you tonight and ask him a few questions. So welcome, Roger.
Thanks, Sue, and welcome to the course. I hope you enjoy it.
I'd like to ask you first, Roger, if you can tell us a little bit about the state of play in diabetes currently.
Well, Sue, as you know, diabetes really has escalated in the last few years and will continue to escalate, and there's several reasons behind this. One is the increasing number of people who are overweight and who are obese. It's clear that this is a major health issue now, not only in Australia but around the Asia-Pacific region and also overseas. So the students really are immersing themselves in a public health as well as a medical and nursing issue, which is really going to, I think, increase in the next few years.
Thank you, Roger. What do you see are the major challenges facing us regarding diabetes?
Well, there are many challenges, I think, facing those who are involved in the care of those patients with diabetes. First of all, there's no magic pill. In many conditions, you can perhaps use antibiotics for an infection. You might use antihypertensive agents for blood pressure and statins for high cholesterol, and sprays or inhaled steroids for asthma. But in diabetes, particularly type 2 diabetes, one's care needs to be multifactorial. You have to address blood pressure, you have to address cholesterol levels, and most difficult of all, I think, is the immense role of lifestyle and diet, physical activity, healthy eating, and therefore one needs really a very tight-knit and if you like, useful multidisciplinary team, which I know leads on to your next question, but a single person cannot look after diabetes. Most of the care is up to the patient themselves. I'd say up to 85 to 90% of the time that patient needs to eat healthily, take the pills, monitor their blood sugar levels, exercise. Extremely difficult. Doctors can't manage these patients by themselves. We need educators to teach patients how to monitor their sugar levels and to talk about complications, to provide general diabetes education, and I believe provide motivation, which can be very important. There's also the role of depression. A lot of patients with diabetes have mental illness, or they may have depression compounding their diabetes, and that's where the role of psychologists may come in. Exercise physiologists, personal trainers might be important for physical activity, and obviously dietitians are incredibly important in advising about diet. So it's a very difficult condition where self-management is vital, yet one still needs the input of all these very varied, I guess, types of healthcare professionals.
Thank you. I think you've sort of answered my next question, but I think my next question was regarding the role of diabetes educators, and I think you've just told us that you think most of the work that's done in diabetes prevention is to be done by the patient. So do you see the role of a diabetes educator as one of as a change agent or educator or motivator or counsellor, or what do you see the main role of an educator as?
That's a great question, Sue. I think you've really nipped it in the bud. You've really mentioned all the roles that educators play. They can play a role of being the patient's, I guess, first contact to talk about diabetes, therefore providing education. They'll often provide the means by which patients will learn how to test their blood sugar levels. They'll provide the means by which patients may learn how to start insulin, which often is very important in their pharmacological management. Educators also have a role as motivators. They're often the psychologists or the default psychologists, and they often provide information about food where dietitians may not be readily available to see the patient. So they really play an incredibly important role, I believe, in the care of patients with diabetes and their management. And currently I don't believe there are enough educators around to, if you like, look after the huge numbers of patients, particularly in the country, but also in some of the outer fringes of each city. So, you know, diabetes educators really need to be increased in number and will have an ever increasingly important role to play in management. Very important indeed.
Now our course, Roger, is very interdisciplinary in nature. We have pharmacists, podiatrists, dietitians, registered nurses, Aboriginal health workers, a whole range of professional groups undertaking this course. Is there anything that you think, I'm sure that in itself presents us challenges in the teaching or the running of the program. Is there anything that you think in particular could be taken into consideration with that cross-cultural or multi-disciplinary group?
Well, I think the main thing as far as the multidisciplinary nature of the group is for each member to recognize that each other member has an integral role to play. There's going to be some overlap, but ultimately we're all working as a team. For example, some nurses will give some advice about what treatment is required to the patient. Some pharmacists will take the role of advising how to use a blood glucose meter. The diabetes educators and the doctors will have some role in looking at feet, but we know that those podiatrists who are particularly skilled at looking at people with diabetes and their feet, again, have an integral role to play, which I certainly, as a healthcare, as a medical professional, won't have the expertise of looking after. The dietitians will often have some overlap in providing diabetes education as well as providing motivation. The exercise physiologists will, often have a role to play in educating patients not only about activity, about healthy eating. So there's going to be some overlap, and as long as we recognize that we can't work in isolation and we have to work as a team, I believe that hopefully along with additional healthcare resources at each level, state and national and local government, that we can optimize the management of patients with diabetes. Certainly we have a mammoth role to play, and I don't think anyone should be doing that in isolation. We certainly can't do it alone.
And as an endocrinologist, would you like to just finish off by telling us, in your role as an endocrinologist, how you incorporate a diabetes educator role into helping you or assisting patients in your role as a specialist?
Well, I think diabetes educators, we've discussed, have various roles in different locales. For example, in the country, where I've worked for a couple of days with some GPs, the educators have an immense role to play. They start the patients on insulin, they'll titrate the insulin, but it very much depends on what the doctor's expectations are. At the Ryde Hospital, where I look after the diabetes centre, we have a very, even like, intimate relationship, not in any bad way. Professionally, we have a very close relationship with the educators, where we discuss the cases, we discuss how the insulin is going to be titrated, we discuss diet, we discuss physical activity, we have regular meetings, and we act as a team rather than one being the doctor and one being the nurse. I guess ultimately I have to give the go-ahead for prescriptions, and I have to give the go-ahead for medications, but I believe we work very well as a team. At Concord Hospital, the Diabetes Centre also works very closely with the endocrinologists, and we certainly see the educators has been essential in providing diabetes education and in providing techniques or teaching patients how to test their sugar levels, how to avoid complications. They will talk about basic foot care, etc. So we certainly work well together, and I see them as a very, very important part of the diabetes care team.
Well, thank you very much, Roger, and welcome everybody. I hope that's given you a bit of motivation, and to me it sounds very exciting. Actually, if I was a student about to start the course, I'd be quite excited listening to what Roger had to say about the role of a diabetes educator, and it's a challenge for us to be able to provide you with a lot of positive learning opportunities so that this year is going to be a terrific year for you. So thank you and welcome to the course, and we'll look forward to more contact with you throughout the semester, and thanks again to
Thank
Roger.
you.